Are you or a loved one suffering from depression or anxiety? Has your doctor recommended that you take Celexa or the generic version of Citalopram? Are you concerned about possible side effects? If so, then this is a video for you. Keep watching to learn a little more about what to watch out for and how this medication can be a help to you. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think this would be something that's helpful to you, make sure you subscribe, hit that notification button, and follow along with us. Well, in today's episode, we're going to be going over a common antidepressant named Citalopram, or more commonly referred to as Celexa. Citalopram is a generic version of Celexa, which was released in 1998. Celexa is a medication that is used most commonly to treat clinical depression and anxiety. It's in the class of medications that we call SSRIs, or selective serotonin reuptake inhibitors. These are a group of medications that target the hormone serotonin and help decrease how rapidly it's broken down in the nerves, thus keeping your serotonin levels higher. It's one of the vital chemicals or neurotransmitters that help regulate a lot of the functions of the body like mood, social behavior, appetite and digestion, sleep, memory, among other things. It's one of the chemicals that plays the big role in depression and anxiety. When you're suffering from depression or anxiety, in addition to things like eating healthy and exercise, counseling and therapy, and getting plenty of sleep, targeting these chemicals in the brain has been found to be very helpful in allowing people to resume a normal life when they're battling with these conditions. Not every person who is suffering from depression needs or even should take a medication for it, but it can be a helpful tool when everything else fails. Now, if you're wondering if taking a medication is the right thing for you, make sure you talk to your doctor. Now, to give you a few ideas on what to talk to them about, watch this video where we go over who tends to benefit from taking a medication. Now, let's specifically talk about what kinds of conditions tend to benefit from taking citalopram. The first condition that we use it for is clinical depression. With depression, you tend to have symptoms like difficulty concentrating, remembering things, or making decisions. You also suffer from fatigue, feelings of guilt, worthlessness, and helplessness. You may also feel hopeless, experience sleeping problems, mood swings, have a loss of interest in things that you once enjoyed, appetite changes, generalized pain, persistent sad or empty feelings, or even suicidal thoughts or attempts. Now, the other common condition is called panic or anxiety disorders. In these conditions, you can have symptoms such as sudden and unexplained onset of rapid heart rate, sweating, trembling, shortness of breath, pain in your chest, fear of dying, numbness and tingling throughout your body, or just a generalized feeling of anxiousness all the time that you just can't explain. If you're going through these symptoms, you need to seek help. You don't need to live your whole life feeling this way. So go see your doctor so you can get an accurate diagnosis and figure out a good treatment plan for you. Remember, depression and anxiety are as real of a medical condition as diabetes or high blood pressure, and you shouldn't feel any different about treating these conditions than you would any other. Okay, so you've talked to your doctor and you both have decided that for your symptoms, citalopram is going to be part of your treatment plan. So what should you expect? Well, first of all, it comes in a pill of doses of 10, 20, and 40 milligrams. Most people tend up on being on the 10 to 20 milligrams. It's the kind of medication that you need to take daily if you're going to be on it. Most people will start to notice a difference within 1 to 2 weeks, but it typically doesn't reach its full effect for 4 to 6. So you should be following up with your doctor within 2 to 4 weeks after starting on it to report how things are working. If you're going to be taking it, you want to make sure that you're not missing a lot of doses. Doing so can really affect how well it's going to work and increase your risk of having side effects. Also, unless you're having some significant problems with the medication, especially after being on it for a few weeks, you don't want to stop this medication abruptly. After being on it for a while, your brain gets used to a certain level of serotonin, and stopping it quickly will really throw you off and make you feel bad. Most doctors recommend that if you're taking the medication and it's working well, you should take it for at least 6 months before thinking about stopping it. Stopping it sooner than that because you feel like your depression or anxiety is gone increases your risk for having your symptoms return. Now, if you feel like it's something that's making a big difference in your life and you want to continue on it longer than the 6 months, then it's safe to do so. I have patients that have decided they need to stay on it for years and that it works for them. So what kind of side effects should you look out for? Well, as with any medication, you can find a big list of side effects that will be listed on the paperwork from your pharmacist. Sometimes these lists can be intimidating, but in the case of citalopram, it's usually pretty well tolerated. It's not very common that many want to stop it because of those significant side effects. However, any medication has a potential of having some side effects. Some more common ones that are possible will be things like headaches, nausea, tiredness or difficulty sleeping, some dry mouth, a tremor, constipation, or even some abdominal pain. These types of symptoms tend to be short-lived in most people, and oftentimes just by modifying when you take it or by taking it with food, you can even improve or even avoid a lot of them. Usually with time, they start to get better on their own. Now, one area of concern that concerns a lot of people is the effect that antidepressants can have on their intimate relations. Now, this is a known problem with most antidepressants, and we do tend to see it a little bit more with Celexa. If this happens to you, make sure you talk to your doctor about your options. But probably the most common reason I have someone stop this or any antidepressant medication is just that they just didn't like it the way it made them feel. Maybe it helped with their depression or anxiety, so they don't feel sad anymore, but they don't feel happy either. Now that certainly isn't the goal of this kind of treatment. Our goal is to help you lift you up out of that hole that you're in and help you see that life is doable again. If we turn you into a zombie and you're either happy or sad, and we're not doing any favors. We still want you to be happy when you're supposed to be happy, and we want you to be sad when you're supposed to be sad. So, if you're noticing things like that, then talk to your doctor about other options that are out there. Now, there are some rare side effects you need to pay more close attention to, though. Now, this isn't an exhaustive list. However, it's important to know that first, all antidepressant medications, including citalopram, have the risk of making your symptoms worse at first. You may be feeling really down right now, but if all of a sudden your depression and anxiety get worse, or you start having suicidal thoughts, you need to be in contact with your doctor and get help. All these types of medications carry what we call a black box warning, or a special alert from the FDA that we should be careful of. Increased risk of suicide is what you need to watch out for. It's rare, but possible, so you need to be careful. I always recommend that when starting these kinds of medications that you confide in somebody you trust and tell them when you're taking it. Let them know about these risks so they can help you recognize what is happening and assist you in getting the help you need. There can be some more rare side effects, such as electrolyte disturbances, allergic reactions, and something called serotonin syndrome, where your body gets too much serotonin. This is very rare, but can present with symptoms like agitation, confusion, rapid heart rate and high blood pressure, dilated pupils, loss of muscle coordination, muscle rigidity, diarrhea, and heavy sweating. If you think this is happening to you, get to your doctor or the emergency room right away. Now, there are some specific things to citalopram as well that you need to be aware of depending on other health conditions and your age. The main concern that your doctor needs to be watching with you is that it can cause something we call a QT prolongation. This means that it can extend the time that it takes for the bottom part of your heart to recharge and get ready for a new beat. The problem with this is that the longer it takes to recharge, it puts you at risk for having your heart going into a dangerous rhythm. Now, to avoid this risk, it's usually good for your doctor to do an EKG or a heart tracing before starting on the medication. The FDA has warned that you shouldn't take over 40 milligrams, and if you're over the age of 60, you should keep your dose to no more than 20 milligrams. There are also medications that you should be careful taking if you're on, so make sure you talk to your pharmacist and just make sure that this isn't a problem for you. One of the over-the-counter medications that you should avoid taking is an acid pill called cimetidine or Tagamet. Also, your doctor may want to check your potassium and magnesium levels because if these are off, then it can put you at a greater risk of having this happen. Now, taking an occasional EKG while on this also may be something you want to talk to them about. Throughout all of this though, if you experience irregular heartbeat, shortness of breath, and dizziness or fainting while taking citalopram, you need to seek care immediately. Now, the worst part about discussing all these side effects of medications is scaring you away from taking them. It's important to keep in perspective that the vast majority of people taking citalopram do really well with minimal to no side effects. You just need to make sure that you're taking proper precautions and are a good candidate to be on it. Now, depression and anxiety can be a very debilitating condition. It's as real as any other medical condition out there. When you have true clinical depression, taking something like citalopram can be just what you need. It's certainly not for everybody, and yes, there are other non-medication options out there that may work for you. If, however, you and your doctor feel that this is the best option for your treatment plan, you now have a good foundation of knowledge of what to expect and what kind of side effects to watch out for. Now, having that information can be really powerful in your life. Well, I hope you found this information to be helpful. If you did, please take time to give this video a like and share it with your friends. It helps our channel to grow and to reach other people that may need this in their life. And if you haven't done so yet, don't leave without subscribing, hitting that notification button so you don't miss out on any of our future content. But until next time, this is Family Med with Dr. Richardson, and remember, take care of your body because it's the only one you have.